This video forms part of your in-service program from Medela. The in-service program will provide you with all the necessary information to operate the Thopaz Plus digital chest drainage system, referred to as Thopaz Plus. It is important that you refer to the Thopaz Plus IFU for further details on how to operate the device. You can also access this in a digital format from our Medela website. We recommend that you download the quick card explaining how to operate the system and to make use of the Thopaz Plus simulator app to familiarise yourself with the device. There is also an accredited e-learning course on chest drain management available for you to complete. It covers basic anatomy of the chest, understanding what chest drainage is and why this is used, along with the differences between underwater seal drains and digital chest drainage systems. Hello and welcome to this short interactive session about how to use a Thopaz Plus. My name is Pav and I've been working with this system for more than 3 years. I spend a lot of my time training clinical staff who are not as familiar with the system. Therefore, I can really appreciate some of your anxieties when it comes to using a completely new chest drainage system. This system provides monitoring of fluid drainage and the amount of air leak for your patient and gives you the peace of mind with the alarms and notifications. Over the next 10 minutes, I'm going to show you how easy it is to set up the Thopaz Plus, and then you can start using it with your patients. The best way to learn and remember is by seeing, listening and doing. So for this session, it is important that you have your Thopaz Plus device, your canister, your tubing and a sealing cap in front of you. If you don't have this equipment, then download the Thopaz Plus simulator app using the QR code or visit the Apple Store or Play Store depending on the make or model of your phone. Once downloaded, you can follow these activities with the simulator. Always get into the habit of checking everything first. Look for any cracks or flaws on the device. Make sure the O-ring is present. Check that the sterile packaging for the canister and tubing are intact. Let's get started. This chest drainage system is unique and quite different to what you have been using before. What do you mean, I hear you ask? Well, Thopaz Plus is a reusable device with disposable tubing and canisters, unlike the other systems you have been used to in the past. You do not throw away the Thopaz Plus, just throw away your tubing and canisters. You do not require to add any water to this system. There is a backflow valve inside the device, ensuring the water seal function. You will not see nor hear any bubbles in this system. Instead, all the information you need to know while caring for your patient with a chest drain will be shown on the digital chest drain display. The Thopaz Plus system can be placed anywhere beside the patient. It does not need to sit on the floor or below the level of patient. It can be attached to the patient's bed or sit on the patient's table or bedside cabinet. It has its own unique docking station where you can charge the device. And then you can lift it out of the station when the patient starts to be mobile. The Thopaz Plus system is fitted with notifications and runs either from the mains or from the battery. Pick up your Thopaz Plus. You will find it is light, 1 kilogram in weight, and has one side that needs to be closed. This is where we attach the tubing and canister. On top of the device we have the display and all the operating buttons that you will need to use. And at the side we have the mains adapter and the USB port. So back to our canister. There are 3 different sizes of canisters, each with its own hydrophilic 3D filter. This filter also prevents any backflow of fluid into the device. The canisters are available with a solidifier that can be activated prior to disposal. If the patient coughs, we have a pressure relief valve here. All canisters have a plastic sealing cap. This is used to seal off the canister when you change it. There are different tubing sizes depending on the size of the chest drain. These are contained individually in sterile packaging. Carefully open one end of the packaging containing the tubing and ensure the pointed end remains in the packaging. Take the other end and insert it into the Thopaz Plus device. Make sure it fits snugly against the housing. Next, remove the canister from its packaging and look for the silver bar. This is another check. If this is not present, do not use the canister. Take the canister and fit the feet first at the bottom of the device. Now push the canister towards the top until you hear a click. To change the canister, you may see that the canister is full, or the device will alarm to let you know that the canister needs to be changed. Press down on the blue button and then remove the canister. Take the plastic sealing cap off and place it into the holes. Now you can dispose this as per your normal clinical waste policy. Okay, now over to you. Complete the following tasks. Check all equipment. Connect the tubing and canister. Disconnect the canister as if changing a full canister. Practice inserting and disconnecting the canister until you feel comfortable. Press confirm. You need to perform a functional check every time you commence therapy with a new patient. Turn the device on. Look at the display. You can see that this lights up now, indicating that you have turned the device on. This light will fade after you have finished setting up the device or checking the data. Pretty much like your screensaver on your phone, and this helps not disturb the patient. Watch for the self-test and listen for the beep. Next, confirm this is a new patient. On the screen, look at the bottom right of the screen and check that the canister size is the same as the canister that you have attached on the device. If this does not match, then the canister needs to be disposed of and replaced with a new one. You will see that the screen now states functional check. Place your finger over the end of the tubing still in the packaging. Press OK on the bottom right of the device. When you see the words test passed, the device is now ready to use. If the test fails, have a quick check of all the connections. Check tubing, check canister, make sure all are correctly fitted. You may need to replace the tubing or the canister. Okay, over to you. Complete the following tasks. Turn on the device. Confirm new patient. Perform functional check. Press confirm. What's the other differences of this digital chest drainage system? This device has its own built-in battery-powered vacuum source. Advanced technology means that any fluid from the patient does not collect in the tubing. It will always be advanced into the canister. No more picking up the tubing and emptying it. This means we are removing the siphon effect that often occurs in underwater seal systems. The Thopaz Plus system is now ready for you to attach to the patient's chest drain catheter. This mobile battery-powered device provides suction for the patient independent of the wall suction. Yes, that's right. Your patients can easily mobilise, be independent, whilst having continuous suction applied to their chest drain or drains. Obviously, you have the option whether to use suction or not. If not, you can select physio mode. Press these two buttons simultaneously. Here you can see the word physio, bottom left, and the display of -0.8 kilopascals. You will see that we offer a variety with units of pressure, kilopascals, millimeters of mercury, centimeters of water, and millibar. You'll find this in the menu. Next, you will need to select the correct amount according to the pressure unit selected. For example, 20 centimeters of water is not the same as 20 kilopascals. Take the end of the tubing out of the packaging and connect this to the end of the patient chest drain. Some key things to remember here are different tubing sizes are available to fit different sizes of chest drains. Make sure you select the correct tubing to fit your patient drain. We can help you with that. To connect multiple drains to one device, you can use the tubing with a Y connector and the tubing extensions. The sample port allows you to take samples of fluid for analysis without breaking the circuit and introducing air or bacteria. We recommend the use of 17-gauge needle. There are detailed instructions in the IFU explaining the steps. You will notice that the tubing has 2 lumens. One is for collecting the fluid and the other is for accommodating an air flush which happens every 5 minutes. If fluid remains in the tubing, this creates a siphon and can compromise drainage function with water seal systems. The Thopaz Plus system has regular tube flushing, which will move the fluid through the tubing towards the canister and so help to prevent clogging of the patient tubing. Okay, now over to you. Complete the following tasks. You may not have a catheter ready, so you can put a sealing cap on top of the tubing to continue the steps without Thopaz Plus alarming. Select your preferred unit of pressure, access the physio mode, then return to the home screen. Select the amount of pressure that is your protocol or physician's preference. Press confirm. Thopaz Plus is intended to be used for aspiration and removal of surgical fluid, tissues, gases, body fluids or infectious materials. It is indicated for all situations where chest drains are applied, especially for thoracic drainage in the pleural and mediastinal cavity in situations such as pneumothorax after cardiac or thoracic surgery, thorax injury, pleural effusion, pleural empyema, or other related conditions. Thopaz Plus is intended for use on patients in appropriate care settings. There are no known contraindications for Thopaz Plus. So how do we know that the device is working? In the top right hand corner of the display there is a wheel that turns. On the display you can see that the screen is split into two areas. On the left shows the air leak in millimeters per minute, completely different from counting bubbles. And on the right is the fluid loss from the patient. You can either see the total or look at the hourly amount. You can zero the fluid amount every hour if you want to by pressing down on this button for 3 seconds. You will see exactly how much fluid has drained since the last time the device was zeroed. Now, when you need to look at what's been happening to your patient and you want the trend of how the air leak is progressing or how much fluid has been removed from the pleural cardiac space, you can access an individualized trending graph. You see these two buttons here. These are unique and symbolize a couple of things. Most obvious is the up and down parts, and this allows you to adjust the amount of suction pressure should you require it. The other markings on these buttons are for air leak history and fluid history. Here you can examine the trends using a 24-hour graph period or a 72-hour graph period for the air leak. With fluid loss, you can examine graphs on a different time scale, 6 hours, 24 hours or 72 hours. This is your patient's history and automatically saved to the Thopaz Plus device, where if you like you can download the entire treatment history. You will need to visit the Medela website and download the Thopaz software and IFU. Okay, now over to you. Complete the following tasks. Look at the wheel turning on the top right of the display. See the display screen in two parts. Zero the fluid setting and make sure that you can see this on display. Select the correct buttons and access the air leak history graph and then the fluid loss history graph. Press confirm. Another unique feature with Thopaz Plus is that you can check the catheter patency very easily. You can only check drains that are in pleural space and without an air leak. Display will read 0 millimeters per minute. Press the button for the air leak history. The display will change. Press the next button at the bottom right until you reach the screen 4 of 4. Follow the instruction on the device. The pressure difference that you will see indicates that the chest drain is patent. Okay, now over to you. Complete the following tasks. Find the catheter check page on the device. You can do this with the simulator. Follow the instructions on the screen. Press confirm. What's the other differences of Thopaz Plus? Thopaz Plus is the only digital chest drain system endorsed by NICE to be safely used with patients recovering from lung surgery or for those who have pneumothorax. These are the basic operations for Thopaz Plus chest drainage. and monitoring system. Thank you for watching, and always refer to our IFU for further details. There are a number of tools to help you. Spend some time on our YouTube page where you have the chance to learn even more about Topaz Plus.